Ready? So whenever you are ready, Lynn.
Okay, I'd like to call to order Board of Health meeting that we're doing remotely from home in compliance with the social distancing. It's March 6th. Time is 1 p.m. and all three Board of Health members are attendant, as well as Kristen Kennedy. Agenda's going to be slightly changed today. Were you going to begin the meeting? Hello?
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 Hi, Kristen. Did it come through what I just said?
No.
Okay, then I called for the meeting to begin. Did that come through?
Yep.
Okay. And then were you going to begin by going over some things?
Yes. Thank you, Lynn. I want to start by thanking all of you for agreeing to model the critical practice of social distancing that is going to be so important in our efforts to prevent the spread of this novel virus. It's only by permission from the governor that in the actions that he's taken lately that we are able to convene this way and move forward with some critical business of the Board of Health. This situation is evolving rapidly, and there have been a number of steps taken over the past 2 weeks by our department, the town, the state, and the federal government. Here in Easton, we began discussing 2 weeks ago how to ensure all the people necessary to respond to this challenge were ready and informed and ready to be part of the response. We've been working together to provide updates and information in a timely manner, and last night, a comprehensive frequently asked question document was added to the town website. We're ramping up to a local COVID-19 resource phone line that we hope will be available in the next few days. And we'll continue to work together with our fellow department heads and community partners to help get the town through this pandemic. At this time, I have asked the Board of Health to join the Board of Selectmen in declaring a local state of emergency.
And for the people at home, Kristen, did you want to just mention, what the benefits of doing that are? Given, hello?
Hey, hello?
Hello?
Hello? Who just joined the meeting?
Tim Myers.
Oh. Hi, Tim. So Tim Myers, our health agent, just joined the Board of Health meeting.
Okay.
So and we were just going to talk about the declaration of the state of emergency in Easton, just briefly.
So as you know, not necessarily in this order, but the president, the governor have both declared states of emergency for our nation as well as for the state. And this is then bringing it down to a local level that the Board of Selectmen and Board of Health have the ability to declare a state of emergency. In some ways it's ceremonial. It just is in a model and a testament to your commitment to the health of the community, largely in the way that conducting business as we are tonight via a phone meeting is one way that we are showing how committed we are to stopping this pandemic by our actions. It is a ceremonial piece, but it is also can set the town up for certain actions. We have not had time to thoroughly investigate all of those, but wanted to seize this opportunity to jointly declare a state of emergency here in an effort to make everybody, have everybody understand how important it is at the local level to be a part of preventing the spread of this novel virus.
Understood. So, do any of the other board members have any questions about this?
Hi, yes, this is Aria. Kristen, I just have a question. So you're saying this is mostly ceremonial. Are there any other precautions other than parameters set forth by the state that we need to be cognizant of on the local level?
I'm sorry, what was the question again?
I'm sorry, my apologies. This is Aria. I was wondering if there are going to be any different restrictions or regulations that differ from the parameters set forth by the states in their state of emergency.
At this time, no. By declaring the state of emergency locally, we are hopeful that it will draw our attention to how serious the situation is. We're also hoping that should there be a need for it to be a part of anything else, as far as whether or not it may come into reimbursement for certain things, or it may position us to be able to move quicker on some emergency actions that the board may want to consider going forward, whether or not it will help us. It's the first step in us being prepared for anything that may come down the road.
Okay.
Okay, great.
So,
Thank you. Perfect.
Chris, do you have any questions on this or comments?
No, not a question so much as more of a statement. So it's my understanding that if we declare this, that, and I'm assuming the Board of Select Persons is in agreement as well as far as a declaration of this nature.
I think they're meeting at the same time.
They are meeting simultaneous to you.
Okay. So if I'm reading between the lines, it's going to help us make a effort to get the message out that we really need people to shelter in place, so to speak. Is that how I'm interpreting the declaration?
It's not a declaration to shelter in place, but it is a declaration of
Well,
the.
to send the message.
To send the message, this is serious, and the only way that the community, and therefore beyond the community and beyond the state, are going to be protected from the spread of COVID-19 is for everyone to take the precautions that we're asking them to take very, very seriously. As the governor said, I believe yesterday, this isn't the time for play dates just because school is out. This is a time for families and households to stay together, stay positive, but to stay away from members outside of their household so that we can basically, to use the term, flatten the curve, stop the spread of this illness. We don't know a lot about it. We don't know how contagious it is, but what we're seeing in other countries and what we're seeing with its rapid spread across the United States and Massachusetts is this is not something to be taken lightly. These actions are unprecedented. I have been doing this for many, many years, and I have never seen reactions and a situation like what we're dealing with right now.
Okay, Christian, thank you. So if we would like to vote in this declaration of an emergency in the town of Easton, do we read the form that you had sent us?
Yes, I think it would be helpful for the people at home and for the record, for one of you to read the declaration, and then it would require a motion and a vote, and we would go from there.
All right, let me read this. Tell me if you can hear me. Whereas the worldwide outbreak of COVID-19, described as a pandemic by the World Health Organization, and the effects of its extreme risk of person-to-person transmission throughout the United States and the Commonwealth, significantly affect the life and health of our people as well as the economy, and is a disaster that impacts the health, security, and safety of the public. And whereas the governor of the Commonwealth of Massachusetts has issued a declaration of emergency on March 10th, 2020, and determined that the immediate public action is needed to prevent, minimize, or mitigate damage to public health, safety, or general welfare of people of Commonwealth, and or property which may otherwise result from the above described emergency. And whereas people of the community of Easton depend upon guidance from their chief municipal officials Now therefore, we, the Board of Health of the Town of Easton, Massachusetts, hereby declare that immediately and effective as of Monday, March 16th, 2020, a state of emergency is declared to exist in Easton. This declaration of emergency shall remain in effect until notice is given pursuant to our judgment that the state of emergency no longer exists. Declared this day, 16th day of March 2020, by the Board of Health of Easton. And now, is there anybody that would like to make a motion?
I'd like to make a motion to, in fact, declare a state of emergency in the town of Easton as it is so written.
Seconded.
Second? All those in favor? Aye.
Aye.
So we unanimously vote that in. Next on the agenda, Kristen, is the, which we may have a few more questions about, is the resolution authorizing you to execute certain matters. Could you maybe give us some information on that?
Yes, so this was an option that was presented. This Board of Selectmen are being presented with the same option for their chief operating official, Connor Reed. In the event that things, that there are certain things that because we cannot convene because of COVID-19 that are, or because there are things that are part of our normal day-to-day occurrence that we would typically ask people to wait to go in front of the board, since we don't know when we will next be having a public meeting, I thought it was prudent to at least put in front of you as an option. The things that I see potentially this being used for would be to approve a betterment loan so that somebody with a failed septic system could potentially start putting their ducks in a row without having to wait for the next time the Board of Health convenes to get approval for that loan. Would be paying some of those overages that we recently have been seeing. There's one that was on the agenda for tonight that was $5,000. And rather than having to wait for us to be able to convene a Board of Health meeting and have public participation and go forward, things like that, that just require your approval. As it says in here, the process would be that I would do that hand in hand, coordinated with the chair, and that any action that was taken would be presented to the full Board of Health within 24 hours and then read into the public record at the next Board of Health meeting. It's an effort to just make sure we can keep things rolling. Another scenario that I envision possibly using it for is every once in a while you guys will have a petition in front of you, somebody looking for temporary housing, for the ability to use a trailer. And that's something the Board of Health can grant permission for, that in this type of scenario, if somebody, the weather's getting nice, if they wanted to or needed to provide for isolation or quarantine of family members and they have a trailer, it would be nice to be able to say, yes, that is a good thing. Let's put, you separate people and put them in the trailer and be able to do that without having to wait for a Board of Health meeting for the board to issue permission. It is not intended, it says right in it, there's a disclosure, it's not intended to give me power to do any type of policy making. It's more directed decision making without having to wait for the board to convene.
Now, Kristen, if this were voted in, so to speak, would we still be having remote meetings, or would those no longer exist?
So we actually need to work out, we're able to have this remote meeting because we're not having any public participation. Some of those meetings may require, or you typically would have required public participation. A lot of this is still being worked out. Again, it was just an option. If you don't want to entertain it, I see it as similar to how you delegated the ability for me to do the local upgrade approvals on septic systems so that people don't have to delay construction of their septic system by coming to a monthly board meeting. It'd be those day-to-day types of things. And again, I don't have to exercise it if I'm uncomfortable and I think it should wait for you, or if you, as the chair, and I discuss and decide that it is something that should wait, we can always not use it.
Right. I mean, I'd like to be put on the record to say that I totally rely on you for a lot of the information we get, and I hold you in the highest regard. All my questions are more along the lines of exactly what are we saying okay to. So if it were something to do with COVID-19, where that's this is a real public health issue, would that be something that you might make decisions on, but on your own, or is that something that you would still have the board weigh in on, even if it be remotely?
This would allow me to make decisions that statutorily rested with you. So it would, anything that I would do normal day-to-day, preparing the Q&A that is up on the website, following through on the day-to-day operations, that's my job. That's what I do.
Right.
Under your direction. This document would allow me to do a little bit more if you were not able to convene. If you're uncomfortable with it, it's fine. We can table it.
Do any of the other board members have any questions?
I do not.
I do, but I'm still trying to sort it through. So,
What I'm thinking is, is this, as the chair, you're not really supposed to say, ahead of time what you're thinking, but I feel like this is a good idea. I'm going to put that out there. I'd like to be able to revisit the decision in case we're feeling like there was something that we didn't realize might result. Is that possible?
Absolutely. The last paragraph says it remains effect until notice is given pursuant to your judgment that it can be revoked.
Okay.
I do have one, and it's pertinent to what we've been dealing with, and it's through no. I'm for it. I just put it out there, but I would like to go on the record to if there's a way that we could put into place that we could be at least read in on some of these decisions. It obviously a lot of this is just benign stuff, but just so we can be kept in the loop, just because where there's a chance sometimes that some of this could get legal, it would, rather than get ambushed by it. You know what I mean? So, I have no problem authorizing it or whatever, but lately the way some information comes to us through atypical ways. So, if there's a way that we could just be guaranteed that we'd be kept in the loop. Hey, I did this, I did that. I don't know if there's a easy way to do it. And I know you're busier than a one-on paper hanger right now, but that is a huge concern to me.
I think I share your concerns, Chris, and I think we should be part of conversations. But I also, like that this came out of nowhere, and I know, Kristen, you've probably been working, 15 hours a day on this. So, but I think I do share that feeling that I'd like to be part of the conversation if it's something that really is what we're here for, the public health issues.
Understood.
So, would we be reading this other document in its entirety too?
Yes, please.
Okay. So the resolution authorizing and directing the Director of Health and Community Services to execute certain essential functions on behalf of the Board of Health during state of emergency declared March 16, 2020. Whereas the Board of Health of the Town of Easton, Massachusetts on March 16, 2020 declared a state of emergency to exist in Easton related to the ongoing threat posed by COVID-19 described as a pandemic by the World Health Organization. Whereas the Board of Health of Easton is prescribe certain functions under Massachusetts general laws, the Home Rule Charter of the Town of Easton, and other local regulations and policies. Whereas certain essential and time-sensitive executive functions of the Board of Health of Easton are hindered by the limitations posed by COVID-19, now therefore we, the Board of Health of Easton, determine that the rapidly evolving circumstances related to COVID-19 necessitate and demand timely and responsive action by the Town of Easton and the Easton Emergency Management Agency to respond to the state of emergency in the Commonwealth of the Town of Easton in such a manner and time frame that warrants delegation of such functions insofar as they are pertinent to the ongoing COVID-19 state of emergency by the Board of Health to the Director of Health and Community Services. Be it further resolved that the Director of Health and Community Services, to the extent possible, execute these delegated functions on behalf of the Board of Health in close coordination with the Chair of the Board of Health, and with a record of any such action taken kept by the Director of Health and Community Services provided to the full Board of Health within 24 hours and read into the public record at the next available meeting of the Board of Health. Be it further resolved that such delegation of authority is designed to ensure that Easton Town government continues in a manner to ensure public health, safety, and welfare of the public, and is not intended to delegate significant policy-making discretion vested in the Board of Health. This resolution shall remain in effect until notice is given pursuant to our judgment or upon the expiration of the Board of Health's March 16, 2020 declaration of a state of emergency, whichever comes first. Resolved this date, 16th day of March 2020 by the Board of Health members. Do we make a motion on this?
Yes, please.
I make a motion to authorize and direction to allow Director of Health and Community Services to act for the Board of Health in cases where it's statutorily allowed and to execute all essential routine executive functions on behalf of Board of Health, provided execution is in coordination with the chair and copy of action taken on behalf of Board is recorded and provided to the full Board within 24 hours.
I second the motion.
All those in favor? Aye.
Aye.
Thank you. Thank you, Kristen. Thank you for everything you're doing.
Thank you. I just want to, if there is anybody listening or watching, the Board of Selectmen are also meeting right now considering these types of actions. Connor is going to be presenting a little bit more of a detailed what's been going on in all of the departments to ramp up for this. But I do just want to draw our attention to what we were able to produce yesterday, largely because of the research efforts of our newly hired public health nurse, Christina Flanagan. We have a very comprehensive but very easy to process question and answer, fact, frequently asked questions document up on the webpage now. It goes through from the very beginning as to what COVID-19 is. It talks about the spread. It talks about who's at higher risk. It talks about isolation and quarantine and what we can all do to help flatten the curve and reduce risk of spreading. And I would just draw everybody's attention to it. If there's anything missing on it, it is a live document and we can add to it if need be. As I stated in my opening remarks, we are ramping up to hopefully have a COVID-19 phone line available, hopefully tomorrow, where residents will be able to call in if there's some information that they're missing or something that's come up that they just don't know how to handle. Our resource coordinator, our outreach coordinator has been working side by side, pulling resources together. We hope to be here to support the town as we go through this together.
Thank you, Kristen. I saw it. It was really, really great what's up on the website.
Actually, to take that a step further, I'm pretty sure been copied by some other towns that was so good. I've gotten a lot of good, yeah, I was just working today, at the fire department, being able to talk to some of the other fire departments in the hospital and stuff like that. I feel like the town of Easton is actually very proactive and right where they should be, meaning we are ahead of other towns as far as dealing with this, which is kudos to everybody. It's important. I don't think the community has any idea as to how contagious this is and how it's spiderweb from one person to that person to that person to that person. And having these resources available within the town is actually it's pretty amazing. From for the health, the local government. It is I definitely would like to be kept in the loop if they're considering any more closings or whatever like that. And if there's any way to get the message out to people to stay in as much as humanly possible. It's difficult to do, but that is, if everybody stays in for 2 or 3 weeks, it's going to self-correct. But
I agree.
it's very, very hard to do. I was at the hospital today. I had a person walk up to me, and my partner outside, fortunately not that close, to say, "Where do you go to get tested?" No mask, no nothing. And that is what a lot of what we're dealing with right now in healthcare is. I don't think people have any idea. As a matter of fact, I just got an email that was a presumptive positive at Stonehill.
Yes.
I don't think people have any idea how it's catchy, and this is a nasty one. This is catchier than most, and it's great. If the weather's starting to get nice, it's impossible. But today, looking at the playground, seeing kids playing and everything, which is a beautiful thing to see, except it's too close. Kids especially are not. They don't know yet how to not spread germs. They don't know yet how to stay away. They can be told it, but then they get caught up in the moment because the kids are what they're supposed to do. And it's up to us as parents. Sometimes it stinks, But this is my 2 cents. But I think the town of Easton is doing an above job with public information and with what they're doing. I came to work today, and there were people already spraying cleaning solution everywhere. When I came into work, it was nice to see. It's like it's nice to be in a working environment where you know that everything possible is being done for our safety and for the public safety. So thank you.
Thank you, Chris. There's also some comments that and I just would want to reiterate that some comments that Connor had made, and they're really, to me, really hit the head of the nail. And it's whether there's a presumptive positive case, that person is under isolation, and whether or not that is on your street or it's just a number on a county-wide database, which feels like it's so far away, the actions that we all need to take right now are the same, and it is the social distancing. It's avoiding the non-essential gatherings. It's the good hygiene. It's following the guidance of the public health officials. This is true regardless of the number of cases that we have. The only way we're going to be able to stop this is to take proactive measures now.
Exactly. And if there's anything, I know I probably speak for all of us on the board, if you need help with anything, not only do we want to be kept in the conversation, we want to be able to help you. I know you and Christina have been working crazy hours doing all this, but we're in a unique position where you have 2 people in the health field, and one with crazy analytical skills. So if there's anything you ever need, let us know.
I appreciate it. I appreciate the support. We're going to get through this. We just need everybody to do their part, and social distancing is the tough part now.
Right. Okay, so in moving on with tonight's agenda, if there's nothing else that we need to talk about regarding those 2 proposals in COVID-19, are we moving on to the variance at Meadowview?
I would recommend that you table that and the betterment as well tonight.
Okay, perfect. Okay, that sounds good. And by our proposal, that's something that you would be handling on your own, or?
The betterment, yes, the variance will come back to. I'm gonna have to look into statutorily whether or not, I know what your feeling is on that one, as we were able to discuss it last week, but I'm not sure whether or not the action we took, while I have you available for it, is enough to allow me to grant a variance. I have to run that back through council.
Okay.
If not, we'll bring it back to you when the time is appropriate.
Okay, and I know I can speak for myself. I'm not sure about the other board members, but if it helps to increase the frequency of our meetings, if you think that's something that's going to help, that's something that I would be able to do.
Me too. Yeah, I'm happy. I'm happy to meet every other week or as necessary.
If you feel that will help, we don't want to make things harder.
No, I mean, we can continue to monitor it. As I said over the weekend, I'm going to try to at least give you guys an update via email every other day, if not every day, and especially if anything is changing dramatically other than the numbers just going up.
Okay, that sounds good. Thank you very much for everything you've done. Is there anything else that we need to bring up at this time?
I have nothing else.
I have nothing.
Okay, so I'd like to make a motion to convene the meeting March 16th at 6:33 p.m.
Second?
Okay, all those in favor? Aye.
Aye.
And we, thanks again, Kristen. Thanks for everything.
Thank you, guys.
Alrighty, bye-bye.
Bye-bye now.
Bye-bye.
Bye.